Good afternoon, Meridian. Today we have a special program for the business community. With the recent increase of COVID-19 cases across the state, last Friday, Governor Little rolled the state back to a modified stage 2 in the Idaho Rebounds Plan. Fortunately, this does not include any business closure this time around, and we want to keep it that way. The Meridian Chamber of Commerce has been working hard to continue to bring you information related to COVID and the impact it has on the business community. We're also finding new ways to deliver you the information on new business openings and the great deals offered by existing members. Our recent Taste of Meridian restaurant tour campaign was an example of this. We had 47 local dining establishments participate in that program and received over 500 entries into the Golden Meal Pass drawing. Last week, we held the first ever Chamber virtual gala and recognized our retiring board members and our new board members. We announced the Woman of the Year, the Man of the Year, and the Ambassador of the Year. We also enjoyed a great keynote message from Kristen Armstrong. You can find the full program on our Facebook page and YouTube channel. We also kicked off our online auction and Shop Meridian campaign. Be sure and visit the Meridian Chamber Gala auction website at meridianchambergala.afrogs.org and find some of those Christmas gifts for your family. Our program today is meant to give you some great information on how to take you and your family's health very seriously this holiday season. We're very proud to bring you this community health update sponsored by Saltzer Health. Please enjoy this message from our sponsor.
I'm Dr. Eric Richardson. I'm a family practice physician here with Saltzer Health in South Meridian. What we're aiming for is to be able to have just a home where each person feels comfortable to be able to get the care that they need. I'm really excited to be able to bring team-based care to South Meridian. I think it's an opportunity where between myself and Kristen, my physician assistant, that we can really just create, hopefully, what you will feel a medical home.
At our new Saltzer Health location in South Meridian, we have urgent care on one side, family medicine on the other, and our team-based approach will be providing the best care possible for our patients here in South Meridian.
I think the team-based care really complements what we're trying to achieve at Saltzer Health, and that really is just take care of the patient. Too often, when you get bigger facilities, bigger organizations, you just feel like a number. But with team-based care, you know your doctor, you know your doctor's assistant, you know who you're being seen by. And we're able to give you that one-on-one quality care that I think too often we're missing in the current medical community. And so hopefully you'll see that, hopefully you'll feel that. That is the vision that we aim to provide, and I think you'll find it at Saltzer Health.
Joining us today is Ed Castledine, Chief Executive Officer for Saltzer Health. Ed is responsible for the strategic vision, payer, provider partnership development, and operational leadership for all healthcare-related entities for Saltzer Health and Intermountain Healthcare Company. Previously, he served as site administrator for the St. Luke's Nampa Medical Center, where he oversaw operations of the new $114 million facility and the onboarding of more than 500 staff and approximately 500 medical professionals. The hospital operations included 3 floors, 87 inpatient rooms, surgery, cath lab, intensive care unit, emergency department, newborn intensive care unit, and numerous outpatient services. Prior to his position, Ed was the administrator for the St. Luke's Health System ortho, neuro, and rehab service lines. He also worked as the consultant and served as CEO of the Treasure Valley Hospital. A graduate of Nampa High School, he earned a bachelor's degree in sports management from Mount Vernon Nazarene University in Ohio and a master's degree in business from Northwest Nazarene University. Ed and his wife, Allison, met in college, and they are the parents of 5 children and 2 grandchildren. Please welcome Ed Castledine.
Thank you, Sean. Appreciate that. I actually didn't know you had that in my bio that I graduated from Nampa High. Very proud of that. And it's fun to continue working in the communities that I grew up in. And And I just count it a real privilege to do that, especially in healthcare. And thanks for the time today. I really appreciate it. And for all of you, those of you who tuned in, thank you. Appreciate your time as well. We'll try to make it valuable. In a few minutes, I'll introduce Dr. Kaiser, who's our Chief Medical Officer, and I'll say a little bit more about him in a few minutes to talk a little bit about COVID. I've done quite a few different chamber events in my career, but I've never done one like this. And I have to admit, it's a little tough to sit here and sit still. I like to stand and move around, so this is a challenge. But I'm really excited to talk to you about what we're doing at Saltzer Health and a little bit about our journey. It was a couple of years ago that we started on this journey to lower the cost of healthcare, and a lot of that's just because of what we know in our gut. In that we know that healthcare costs are just it's just too expensive, and there's a lot of reasons for that, and I'm sure that people get tired of everyone pointing the finger at well, why is it so expensive, and everybody wants to blame somebody else. We really believe that we have the opportunity to control those costs, and we need to do things differently. And so we've been on this journey now for a little while, and are really seeing some great progress. And a lot of that, most of it's because of the great people that we have in Saltzer. Dr. Richardson, who you saw in that video, that's actually the first time I've seen that video, is an amazing physician, an amazing person. And when you fill your organization with a lot of people that care about their patients, like our physicians do, you get great outcomes, and you can lower the cost of care. So we're excited about that. One of the things that I like to just kind of quickly explain is that outpatient services are less costly than inpatient services, and people generally know that, but they're not aware of the fact that we just have a shortage of those types of resources and services here in the Treasure Valley. So we're aggressively developing those services and are excited to open those up. We've already opened a few, and we'll open up more in the next several months, and I'll kind of detail those out here in just a second. But simultaneously, we want to create better access for people, so it's just easier for people to get involved in improving their health. And so those are the things that we're really excited about. When we set out on this journey, who knew that we were going to be right in the middle of a pandemic? Trying to develop services. I get asked all the time, what's it like? I got asked just this week in another interview about, how is it that you guys can continue growing the way you're growing right in the middle of this virus that we're dealing with? And, I think my general answer is I think we've really struck a nerve here in the Treasure Valley. And I think we've threaded the needle correctly with putting and recruiting new and innovative providers into our organization who are passionate about people, and we're finding a lot of success in that, and so we're excited to keep this momentum going. Sean, if you want to go to the next slide, I've got whoever's advancing. I want to talk a little bit about our footprint real quick. There's a lot of several little flags there, and the print might be too small for you to see. But I'll just point out a couple of quick things. These flags on this map represent urgent care clinics and surgery centers and imaging centers and all those kind of things. But the basic thing I'm hoping to communicate is that Saltzer is growing, and we're growing because the need is there. We in the Treasure Valley, we don't have enough primary care related physicians, and some communities have close to enough, and others just are woefully understaffed in terms of primary care. So we want to recruit and to expand our footprint in order to better care for our community and the people that really want to be cared for by a Saltzer provider. We are in the St. Luke's building in Nampa, in the hospital where I used to be. I was with St. Luke's for quite a few years. Really enjoyed my time with those folks. A lot of great people. We're really blessed in this community to have two great health systems, St. Luke's and St. Al's, and we partner with both of them, as well as Primary Health and others. But our Nampa facility is in the St. Luke's Nampa Hospital and been there for ever since the beginning. And so that's one of our real key points of service in Nampa, as well as on the south side, in the Hawaii location, where most people in Nampa are familiar. A lot of people don't know, though, that we're expanding east into Boise. we've got an urgent care clinic out at Barber Station that will open up in January. And our urgent care clinics are combination clinics where we do all the urgent care related activity, but we also have primary care related physicians as well, because we think it's important not just to take care of someone's immediate need, but to develop the relationship with patients so that they can have great access to primary care physicians. In a population health model, which is where we're at, where we're going, and what our community is demanding, you need access to primary care physicians. In Canyon County, I can tell you that we have one primary care related physician for every 3,300 of our population, which is not the ratio we would want. We need that to be more closely to 1 to 1,000 or 1 to 1,500 at the highest. So just from that, you can see we have needs there that our recruitment efforts are hoping to address. We have a new urgent care clinic out on Chinden that's going to be opening up in March or April. We have one, then we have a couple that we've recently opened. Our Caldwell location on Elm Street, which is right across the street basically from the West Valley Medical Center, that opened up in August. And then our Victory Commons location in Meridian on Meridian Road, those of you Meridian folks know exactly where this is, opened up just in September. It's been really one of the most satisfying things I've been a part of in my healthcare career, to open up these urgent care clinics in areas that are really needing more services, and then to see how the community responds. And it's been great. And both of those clinics have seen enormous volumes, especially with the pandemic, which has been great. I feel like our timing is really good. I kind of feel like we can't open these things fast enough because the demand is so high. And I know we all hear on the news and different stations on the radio where we just hear that people have trouble getting in to see a healthcare provider regarding COVID. And Dr. Kaiser will talk about that in a little bit. But we're doing our best to keep up with that and grow as fast as we can right along with that demand. Next slide, Sean. I'm just going to quickly kind of go through what for us is probably it's definitely our single most significant development, and that's the 10-mile medical campus. This is something that we started planning pretty much from day one. In that we knew that we needed a hub for lots of outpatient related services. And the 10-mile location is just a great spot. It's the geographic center of the valley. And we have great access right off the new 10-mile exit. And so we have great visibility and very, very easy to get in and out of this facility. It's going to open up in December. And there's several services that are going to go in there, as you may imagine, because the building is pretty large. Our surgery center will open up sometime in April is what we're projecting. And so far we're on track for that. It's a multi-specialty surgery center with 21 invested physicians, all sorts of different specialties in there. But it is going to be a really great location for people to get affordable surgery. And so we're excited to offer that in April. But just here in a couple months, our imaging center is going to open up. We'll have a 5-modality outpatient imaging center at this location, offering MRI and CT and all the mainstream modalities with respect to imaging services. And we're really excited for that to open up because, again, our patients, they need affordable care. And these types of services, when they're offered in hospitals, tend to be very expensive. And so when they're outpatient services, then the costs tend to be significantly less. And for our patients, that's extremely important. We'll also be offering physical therapy. We'll have an outpatient physical therapy clinic located here at the 10-mile site. That will open up sometime around in the spring to summer of next year. Our medical office, which will take up the entire second floor of this building, will be comprise half of specialty practices and then the other half primary care related folks. So, and that will open up here at the end of the year. So those things are really key to our service. But the one I want to key on the most here before I turn things over to Dr. Kaiser is our urgent care. we've opened up urgent care clinics around the valley, and you guys know we've talked about a few of them. We have more that are going to be coming in the next 12 to 24 months. But this 24-hour urgent care clinic located at the 10-mile site is really key for us, and it really does represent a new model of healthcare for the Treasure Valley. We have a lot of folks in our communities who go to the emergency departments regularly. I know when I was at St. Luke's, I think we admitted around 4 or 5% of the people from the ED into the hospital. So just from that stat alone, you can see that a lot of people that go to the emergency departments today around the valley really could benefit from just seeing an urgent care clinic and an urgent care provider, and they would avoid the high cost of going to an emergency department. The other thing that we are passionate about is that we don't want to take up space in the emergency departments with non-emergent related clinical care, because we want to make sure that our ERs always have the capacity to take on the most seriously ill people, because that's what it's made for, and that's what they're phenomenal at taking care of. So our 24-hour urgent care is going to be offered to the community in December this year. And we're really thinking that it's going to drive there's going to be a lot of interest in that. Folks that can get in and out very quickly and then can be connected seamlessly with a primary care physician is going to provide a great benefit. And we're super excited about this. You know that we've joined Intermountain Health. Intermountain down in Salt Lake has 30 urgent care clinics, and none of them are 24 hours care. And so as it's been exciting to talk with our new partners about what we're doing up here and the vision that we have. And all eyes are on this location, and we think it's just going to be a great service for us. So we're excited about that. So I'm going to turn this over to Dr. Kaiser. Most of you know John Kaiser. He is a practicing OB-GYN physician. He's been at Saltzer for over 21 years. But what you don't know is he's an avid golfer. Well, some of you probably do. He's an avid golfer. He's actually a good golfer. He was an engineer before he became a physician. So he's one of these guys that just naturally is smart and can do a lot of things. But the most important thing about John, he's a great leader. Our organization would not be in existence today. I can tell you honestly, with all the different transitions that Saltzer has had to go through over the past 8 to 10 years, this group would not have held together without Dr. Kaiser's effort and leadership, and frankly, relationships. And they call me the CEO, but actually John is the leader of the group, and we take our cues from him. And I'm super excited about working with him, and the work he's been doing is phenomenal. And he's going to talk a little bit about COVID, all of our favorite subjects. So, John, the floor is yours.
Thank you very much, Ed. That was very kind. I do want to correct a mistake he made. I'm not a good golfer. So, with that said, my favorite topic, I didn't know I was going to spend so much of my time in the last year dealing with infectious disease, but it's been my honor to try to help in this new front that we have. COVID is brand new to us. We've never seen something like this. So I think I want to start with a little perspective. I think we have done, we get down on ourselves all the time for what's going wrong in how we're dealing with this. And there are certain lots of areas that we can improve. But if you think of where we came from in March, not knowing anything about this, and what's been put in place across the country and our own communities to try and address the needs that this pandemic has brought upon us, I think we've done a really good job. So I think there is a different perspective that you always have to have, and give yourself credit for where you've made progress. We're going to continue to learn a lot about this disease, and I'm not sure we won't need it for another round of different things. I never wish that on anyone, but I do think it's a possibility that we will have to deal with this type of situation for a long time to come. So we need to figure out what are ways to cope with it, what are best practices to help us through this and decrease the disease burden, so that we can keep our economy going, so that we can keep our citizens productive and our businesses productive. And what do we need to do in healthcare to help accommodate that? So First thing I'd like to do with those introductory remarks is tell you where we're at with some of our statistics. So if we could have the first slide. Very small, I apologize. So we do testing primarily in our urgent care clinics, and we track it by county and overall. And as you can see in this slide, when we first started, we thought the disease burden was significant. We were in a lockdown. And then we had a second fairly significant spike that occurred around the July timeframe. But then if you look at what's happened most recently, we have significantly increased the percentage of positive tests. And the other thing that last week we did over 1,700 tests in our clinic. When we were back in the peak of July timeframe, we did about 1,000 to 1,100 tests. In the beginning, we were doing about 200 to 300. So those are significant numbers of tests that we've done. In Canyon County alone, we've done over 11,000 tests. We've done over 20,000 overall. And that positivity rate in Canyon County is 30%. It's too small for me to read the exact number. I know overall it's 31, and it's something like 31% there, which is, if you think about that's a significant number. So 30% of the people that come through the door, and those are mostly people who are symptomatic, who are coming to our clinics to be tested, but there's also a portion of those that are patients who have had an exposure to someone who was positive for COVID, tested positive, and they come in to be tested for various reasons, for returning to work, to knowing if they should quarantine and all those type of things. That's a really high percentage. So 3 out of 10 people that are coming through our doors from Canyon County are positive for COVID. Next screen. Ada County is also, so we had a really high spike in percent positive, but a lower number in Ada County when we first started. It went down to much lower numbers. And then again, this last spike has been back up to our high points, which are 31% positivity rate for Ada County. And unfortunately, this week's early numbers are also showing that it seems like the rate is continuing to climb. And when I look at the CDC sites and projections for where we think this is going, we don't see this ending soon. We think it's going to continue to be at a fairly high rate for a while as we continue with the disease. We need to think about things we can do to help decrease that disease burden amongst our patients and amongst the community. So we know the things that tend to work. And if you go to the next slide, I'll show you some of that that information, then I'll share a few other points. Clearly, the most important thing we can get to our community and try to get all of the businesses to adhere to is requiring masks to be worn. We know masks are effective. I always joke when I see somebody who's wearing it inappropriately is that that's not a chin strap. That's supposed to be up over your nose. That's how it's effective in preventing the disease. And the reason, and there's all kinds of statistics. I know there's different opinions, but really the science behind it is very good on how it helps prevent you from spreading disease. And then some of the more recent small studies that need to be validated have also shown that it can protect you from from getting the disease from someone else who is positive. The risk when you both wear a mask is so dramatically decreased for spread of the disease that it's significant and is the most important thing we can do. We also know that this disease spreads mostly by large droplets. So large droplets tend to not spread as much as very aerosolized kinds of diseases that we have. And so 6 feet is a good guide. Is it absolute, and is it always protective? No, but it is a significant deterrent from spreading disease. We say if you can't have social distancing, wear a mask. I think the combination of the two, even if you can keep social distancing, wearing a mask is going to significantly decrease the risk of spread of that disease. And we know you can stop the spread of this disease by not touching your face, your eyes, your nose, your mouth, unless you have recently washed your hands. So hand washing on a frequent basis using the 20-second soap and water routine or using hand sanitizer is a significant deterrent to spreading disease. It's just part of our culture that we need to develop and use in our normal day thinking. Those are the main ones. I'd like to go over briefly what the new recommendations are from the Public Health Advisory from Central District Health in reference that were just released on the 17th. And they have, again, re-emphasized some of the points that they've made before with the importance of wearing the mask at all times you're around anyone. There are very, very few exceptions. I know you hear about exceptions quite frequently. Really, the only legitimate exception is children less than 2 years of age. The others are typically exceptions that your health has to be so compromised as to not allow you to wear a mask that you probably shouldn't be in public anyway, because your disease risk is so high, you should be isolating most of the time. So really, everyone should be wearing a mask. Asthma by itself is not a contraindication to wearing a mask. So I think you should all feel comfortable that a recommendation and a requirement to wear a mask is very, very reasonable in our current situation with the pandemic and the disease burden that we see in the public. The other recommendations that they have is where you can work from home. I mean, we've implemented that at Saltzer. I mean, we mostly have clinic providers who can't work from home, but where we have other services, working from home is very, very reasonable, and you should use that, and people should be encouraged to do that. They'll remain productive. Studies have shown that working from home has not decreased productivities in those areas of work where it is applicable. In fact, productivity has increased in some of them. So I think it's a reasonable thing to do. They also recommend, Central District Health recommended minimizing non-essential travel. We're trying to adhere to that within our operations with some of our other companies that we deal with to try to decrease the risk for spreading. Of course, suspend any visits to long-term care facilities. Those facilities have patients who are severely or have a significant elevated risk because of the population that they serve, the age, elderly above 65, and with also multiple medical conditions. So that should not be on the radar for anyone to visit those. While that's a difficult situation to deal with in families, it's the best thing you can do for those people who are residents there. Avoiding social gatherings. The recommendation is less than 10. We don't recommend that people congregate above 10 unless it's immediate family. And I'm going to talk a little bit about some data that talks about how the disease is spread even in families where there's a positive patient. Anyone who's 65 or older, smokes, health conditions that put them at risk for severe outcomes should avoid close contact with anyone other than immediate household members. And those are people who have COPD, chronic kidney disease, heart conditions such as heart failure, coronary artery disease, other heart conditions, those who are immunocompromised, especially those who have transplant for solid organs, who are on immunosuppressive medication. All those should simply stay away from people. Severe obesity is also a significant risk factor for patients in developing severe complications associated with COVID. COVID is highest risk for the elderly and those that I mentioned with those conditions, but we know it affects every age bracket there. Young children are much less risk for having significant disease, but as you know, you've seen in the press, there are rare cases of significant disease in the young, and we're seeing more cases of it. We don't understand exactly why. Some patients develop a much more severe illness. I've read through lots of things that talks about different populations in the world about what's the antibody level, and then why do some who have same level of antibodies just in the general population tend to have such a higher risk. And there's something in the genetics of it and how it mutates that makes some people much more at risk for developing that severe illness besides these conditions there. We just don't know all of the facts, and we continue to learn as we get more experience with this and more science behind it. The other Central District Health recommendations on businesses is to implement delivery and curbside service. implement virtual services for places of worship, the concern on sports where you have a significant disease spread and recommendation to discontinue those when you don't have the level in the community that's below the thresholds that have been set by the various school districts. Bars and restaurants, breweries, takeout only, close at 10 p.m., gyms at 50% capacity. Those are all the things that I think are prudent things to do to help decrease this. If we can start to suppress this rising rate, we have a much better chance of controlling what happens into the future. We don't want to go backwards one more step. We cannot afford that, and we don't want that. We as a healthcare community are trying to do everything we can to educate, to tell people when they should isolate, to try and get them the assistance. We know it's a significant effect on mental health, trying to offer assistance where we can in that front, because this is very taxing and wearing on us. This is not how we normally live. So we all understand the severity of the other consequences of this disease besides the physical nature of infections that can become very severe. The last bit of information I wanted to kind of go through, which I think is kind of interesting, there's all kinds of studies that have been done that I think lend some more light on it. A lot of them are small studies, so they have to be taken with a grain of salt. There was a study that was done in Atlanta, Center for Disease Control and Prevention in Atlanta, looked at 191 families who had a positive contact. And then they went back and tested the other family members that they lived with, close family members, to see what was the disease spread for these close contacts that live in families. And they tried to make it as conservative as they could. So they took out of the study the initial positive patient. So they didn't count that person. And the reason they did that is because they didn't know if that person caught it from someone else or not. So they took that person out to make it as conservative as they could. And then they went and looked at those family members and tested and retested them and looked at antibody levels over the next month. And about 35% of those close family contacts became positive within the testing time period, which was primarily within 14 days of that first person testing positive. That's much higher than what we thought in the beginning. And the next thing they found that I think was very interesting is that 75% of those patients who were tested positive in the study actually didn't have symptoms. So it just shows you when you get together, even in family gatherings, while we accept that, there is still significant spread that's going to happen in those settings if one person is positive in that group cohort. So it's a little daunting to think about that, and we don't want to scare everyone, but we do want people over this Thanksgiving holiday to take things seriously. You can wear masks when you're with family members. Some you would recommend that they wear masks. Just kidding. Other things you can do is try to distance as best you can, open windows in your family celebrations if it's not too cold, and try to mitigate that risk as best you can, because we don't want to see another rise coming out of the Thanksgiving holidays. If you can hold things outdoors, that's even better, but in many places that's just not practical. Those are some of the things. There's lots of other studies that are out there and interesting facts and curious facts about the disease, but that's kind of some of the information I wanted to cover today. So thank you very much.
Thank you, Dr. Kaiser. And for those that are online with us, you can put in questions for Dr. Kaiser or Mr. Castledine in the comment section of Facebook, and we will get to those. Dr. Kaiser, I do have a question that came in through our YouTube channel. The numbers that you shared earlier, these are specific to Saltzer medical sites only, correct?
Yes, this is only data that we collect through our testing locations, which is primarily urgent care, and then we do have we do some testing within our clinic itself.
How do you see that comparing to the other healthcare providers in the community? Are they seeing similar numbers?
Theirs are not as high as ours. I mean, they're up into the 20% range. Ours has been significantly, or has been higher all along. Canyon County has always been higher for us. This is the first time Ada County's kind of popped up. Our numbers are higher than the state reported numbers for percent positive. Just has to do with the population we're seeing.
Okay. Another question is, we hear a lot about the mental state of people in this, but we're also concerned about the state of our healthcare community. What is the status of Saltzer's medical staff, and how are they handling the situation?
Yeah, I mean, I think we have some of the most dedicated providers that you can imagine. Is it wearing on them? Absolutely, especially in our urgent care locations where I didn't talk about the volumes. We're seeing this month, if it stays the trend we've had, we will have seen 3 times the amount of patients that we saw last year at this time. And that's a lot of testing, that's a lot of counseling, that's a lot of evaluation. And people get frustrated because there are waits associated with it. So all that wears on our healthcare providers. But I'd say overall that we've done very, very well in keeping people focused on providing care and understanding that it's an unknown and people are going to be frustrated, and letting that being the level set mindset that you go into this with, and provide the best care you possibly can. So I think we're doing good overall, and we just need to help continue that and keep everyone focused on the task at hand.
Thank you. Dr. Kaiser, we are entering, I'm not sure if we're in it or if we're close to entering it, the regular flu season. What do you see as the biggest challenge that we face? Or are we looking at a flu vaccine this year that may be pretty effective?
Yeah, I think we never know about the efficacy of the flu vaccine until you get quite a ways down the road. It's early for us to see a flu, a spike in the flu season. It usually comes a little bit later. We have had cases of flu already. We hope and we think that the flu season may be mitigated because of the mask wearing. I mean, that's how you prevent flu also. And so we've never done this before. So we're hoping we actually see a lower flu outbreak than we have in the past. With that said, if you do get the flu, and that's why the vaccine is so important, you are at higher risk for having, and then you get co-infected with COVID-19, the coronavirus, you have a higher risk of having much more severe illness than if you don't have the flu before you get the COVID-19. So it is important for everybody to get out there and get the flu vaccine. We're also very hopeful that we'll have COVID-19 vaccine within the foreseeable future, which will obviously help with that. But I think our bet is that we have less flu this year. I think the harder part for us as providers is how much testing do you do? I mean, so the symptoms are very, very similar. There's such an overlap on them. So, do we have to do 2 tests? There are some tests available that test for both at the same time. We're looking into those. So there are some technical issues that we will address as we move forward in the flu season.
Okay. National news is obviously talking about the COVID vaccines that you're hearing from the 2 different companies. How does the healthcare community see the vaccine and its rollout timeline having a real impact on, returning to somewhat normal activities? What is your thoughts on that timeline?
And none of us know, quite honestly. I mean, so the distribution will come from the district health to the different healthcare entities with tiered levels of risk for rollout of the vaccine. The vaccine some of the vaccines also have some strict storage requirements, which are difficult to maintain. And so we're trying to work our way through that. There's multiple meetings that are taking place. We're trying to figure out how we're going to handle that. I think that if we're very lucky, the initial vaccines will come at the first of the year. Supply of those will go to healthcare providers. And so then it's going to take a while to get the quantities needed to get into the public. So I think realistically, it's going to be a ways down the road before we'll see a significant impact in the disease burden in our communities from the vaccine. It is the best thing we have on the horizon, but I do think it's going to take a little while to get into the mass circulation.
Okay. Well, thank you, Dr. Kaiser and Mr. Castledine, for presenting to us today. We appreciate you taking the time to update the Meridian business community on the health crisis that we're facing. Thank you both very much.
Thank you.
And thank you to Saltzer Health for sponsoring today's program. We have a responsibility in the health of our community, so please do your part and keep Meridian healthy and open for business. Thank you very much, and have a safe Thanksgiving next week. Thank you all.
Thanks.
Thank you.